Hi, welcome to my YouTube channel. My name is Boboski. Kindly like, subscribe, and share my videos to help somebody else. Today, it's just a continuation of what I had studied earlier. We had earlier discussed about the pills, intrauterine devices, condoms, both male and female, injectables, and implants. Today, I have brought you the actual thing so that you can understand better. This is called progestin-only pill, POPs, and it consists of a hormone called levogestrone tablets. Yes, levogestrone tablet, which is 0.03 milligrams. This one is mostly used by women postnatally, 6 months after giving birth. And one is supposed to take each tablet daily for 6 months without stopping or without having a break. This box contains 3 cycles. Contains 3 cycles. So when a mother comes to the health unit, we tell them this one has a marking of Sunday, Monday, Tuesday, like that. If the client came to the facility on Thursday, to avoid confusion to this young mother, you just advise the patient to start from Thursday, where it's labeled Thursday as the first pill. So the person will continue until she finishes a whole packet. These are 35 tablets or pills. After this packet is over, the client is supposed to continue with another packet without having any break. Don't be confused by people outside. After that, you take the third one, non-stop, until the baby reaches 6 months. After 6 months, you can be changed to combined oral contraceptives. Some people like calling it chaguo lako because that's how it appears. I hope it's here like this, chaguo lako. This packet too consists of 3 cycles. And one is supposed to start from where it's written. If it's a number or a day, that's when you're going to start. If it's only just numbering, if you start the pill today, you start with the number 1. And then continue until you reach the last one. This packet consists of 21 pills. After you finish the 21, for this one, you have to rest for 7 days. By that time, you may receive your monthly periods. But on the 8th day, whether the periods or the menstrual cycle started yesterday, you have to continue with another packet from the 8th day after resting. I'm going to clarify about this same pill. There are others that consist of 28 tablets. The white tablets, pills, let me call them pills. The white pills are the hormonal ones that prevents one from getting pregnant. There are others that contain 28. You'll find another row there of 7 tablets, making it a total of 28. Even though these days they are not so common, the 28 are like hematinics plus some multivitamin boosters. So when it's 28 too, you will start with the white ones, and when you finish, you continue with the brown. They're usually brown. You continue with the brown ones. And when you finish, you have to start another cycle. I know you're asking a question. Yes, I had said you rest for 7 days, and on the 8th day, you take another one. But now, I'm talking about the combined pill that has 28 pills, but only 21 are hormonal. The brown ones are just to boost, like hematinics and something like that, a little bit. When you're given the 28 pills, kindly don't start with the brown pills, because those are not hormonal. You'll get pregnant. So you have to start with the white ones and finish with they're brown or red. After that, you take another one. But in case you get this one of 21, just follow the instructions that are given you. This one contains of levonorgestrel and adenoestradiol hormones. I hope I'm not confusing you more. I'm trying as much so that you can get the right method and have the knowledge before adapting to any method. From there, we have the implants. There are different types of implants. There is Jadel. There is NXT. NXT consists of one rod. And as I had told you earlier, implants are inserted either on your right or left arm, upper arm, depending on the less active hand. If you're right-handed, it's placed on your left. If you're left-handed, it's placed on your right. And it is inserted somewhere here. Subdermally or intradermally. NXT and Implanon stays in the body, gives you services for 3 years. After 3 years, they are removed and you either conceive or get another one fixed. We have another type of implant. It's called Jadel. Jadel. This one goes for 5 years. And it consists of 2 rods. You can see them, those ones. These 2 rods are inserted just the same way as an NXT and implano. If you want to get pregnant, it can be removed. If you want to get pregnant before the 5 years or maybe 3. But if you want to conceive after 3 years, it's better you prefer the one that goes for 3 years. Because it's like wasting this for somebody who wants to stay for many years without conceiving. Yeah. That is it. When using the gel, we have some, it's called an introducer, this one here. This one is just to aid the healthcare provider to insert the implant on your upper arm. After the implant is inserted, it is discarded. It is only one use. No contamination, no nothing. One client, one use, discard. Before it is fixed, when the implant is fixed, we inject local anesthesia on the area that the insertion is going to take place. This is to minimize pain while insertion is taking place. It makes the area a little numb so that you can not feel any pain or discomfort. It is just a simple procedure and the best, because after insertion, you will stay free without thinking about getting pregnant. You won't be worried about anything that might happen because you will be covered for 5 good years. After insertion, we place an elastoplast at the site where we had pricked. And anybody after insertion, you are kindly advised not to lift heavy things for at least 5 days so that the count can heal properly. When taking a shower, you take care of the wound. Don't put water around the area because the wound will get sore-like and it won't be good. I hope it is clear. And kindly don't fear about implants. Implants are the best. Every method is good, but implants are good because you don't have that worry of today I missed my pill, nini, like things like that. After that, I'm going to show you another method which I know most of people who don't like hormonal things might like. This is called IUCD, intrauterine device. Most people like calling it coil. And there are myths and conception that goes around in the community. People saying that it disappears in the body or goes to the heart. That is not true. The heart and the uterus are 2 different organs and located at different areas. This one is inserted in the uterus through the vagina and cervix, and it stays for 10 to 12 years. At 10 years, if you want to remove, you can remove it. but it should not stay in your body for over 12 years. It has to be changed, to be removed and changed. Or if you want to conceive after 10 years, well and good, it is your choice. I hope it is clear. When a coil is being inserted, there are those people who fear that they'll feel pain, which is not true. There is no pain, but there's just a little discomfort, especially when we are opening the vagina so that we can visualize the cervix, so that we can fix it. Let's assume this is the vagina. The vagina is always like this, so that we can fix this one. There is something called how many have seen this thing? I know this is what many people. It is called a speculum. These speculums are of different sizes, because if you're small-bodied, they are smaller ones. If you're big-bodied, they are bigger ones. Yani long, not as big as but long, so that you can fix, because there are people who at times they are big, they are blessed with big bodies, so that to visualize well, you need something that is a little bit bigger. You can find this metallic one or plastic, the disposable ones. It is not painful because it's lubricated before insertion, so that you don't feel the discomfort. So we said this is the vagina. So we have to go slowly, gently. It's always gentle. Never be cheated by anybody. No health worker can push it as if pushing it in a cow. Yeah, it's so gentle. When this one reaches at the tip of your vagina, here, the health worker will try to open it like this. I have to do some practical so that I don't want people to fear this, because this is the best. You can imagine if you don't want to get pregnant for the next 10 years, this is ideal. You see? Now this is the vagina area. So we want to visualize where the cervix is, the tip of the cervix, because this one has to go through the vagina, in the tip of the cervix, and into the uterus. In the uterus, it will stay like this on top. Let's say this is the uterus, the fallopian tubes, where the ovum travels from both sides to go to the uterus and maybe ready for fertilization or for menstruation. After insertion, you won't feel. This is the tip of the cervix now. These threads you're seeing here, they are placed on the sides in the vaginal wall, just somewhere at the top. And with time, they'll get used to the body and they'll be soft and nobody can feel them. Now, there are people who say, my husband said can feel the IUCD. It is very rare unless it is not inserted well. Before an IUCD is fitted, there are measurements that are taken for the size of your womb. So if it is less than 5 centimeters, in fact, that one cannot, let's say 5 centimeters. If it is here, that shows your wall is, the uterus is small. And so this one can even come out. Yeah? Maybe that is when the husband can feel. But when it is around 6, 7, up to here, the length of your, I'm talking about the length of your uterus after insertion. The coil or IUCD will reach somewhere here, and the rest is part of your uterus, and the cervix is here. So there is no way your husband or partner can feel it during sexual intercourse. So come for the coil, be comfortable, and enjoy your sex life. Don't deny your husband sex because some say he'll feel the dreads. No, it doesn't happen like that. I hope it is clear about the IUCDs. I hope it's interesting. Reproductive health and family planning methods. When you are taught well, you will have no fear in choosing the right one or the long-term methods. Now here we come with other methods. We had talked about the condoms. This is the female condom. And this is the male condom. It's called Sure. These are most available in our government hospitals, even though there are others who say they prefer the ones they buy from chemists because they have flavors like pineapple, apple, orange, grapes, I don't know. But what I believe is a condom is a condom, provided it protects you from sexually transmitted diseases, prevents you from getting pregnant or having HIV or AIDS. Before you use any condom, first of all, you have to check if it is intact, no breakages. Check on the expiry date. If the date is expired, kindly don't use that one. Discard and get another one. From there, we can open gently. We've already confirmed that there's no breakages. It is intact. The expiry date is okay. Now you're ready to have sex. You peel it nicely. And then it should be placed. Let's assume this is a penis. I'm sorry I don't have a penis. I could have demonstrated. Let's assume this is the penis. So I'll remove my condom gently. You check on the tip. So you place it gently. You just roll it down, down. It should and must be an erect penis. If you place it in a flabby one, it won't work, or it won't be fitted well. Now my condom has covered the whole penis up to the base, from the tip to the base. Make sure this tit is like that, and there's no air, because if there's some air, it shows sperms can penetrate through and somebody gets pregnant, and one will be saying, see, we used the condom, what happened? Yeah, so you have to be careful, no breakages even in there, and the tit is like this. This helps to collect sperm while having sexual intercourse and after ejaculation. After you finish enjoying your sex, kindly take a tissue paper or a serviette. Yeah. And sorry, this will disturb me because it's not a penis. And hold like this and remove gently down. At that time it won't be hard because the penis now is not erect, it has relaxed, so it will be easier. Your partner can do it, or you yourself. I hope you can see. Until it is completely out, gently making sure you don't spill any content in this condom, or maybe even spill it on your partner's vagina, because the sperms will swim. You know, they swim, and then somebody might get pregnant. Whose fault is it? The one who removed the condom without taking caution. Now this is the used condom. After you remove, kindly throw it in a pit latrine. And if there is no pit latrine, put it safely, and then in the morning or whatever time, go and burn it. It is so embarrassing when you walk around and find children using these things like balloon. Remember, your sperm is there. Maybe even it is your child or your neighbor's child, and then you're busy enjoying them, enjoying whatever they are doing, like, because they think it is a balloon. Remember, your sperm is here. What damage do you do to the community? Remember, safety begins from me. I use it, package it well, and discard. If you want to have another round, don't use the same condom. Kindly take another one and continue with your game. Remove gently and repeat the same thing and discard. Some people say That condom is too tiny. Do you know this thing can hold up to 20 liters of water? Maji ya mtungi 20 liters gallon of water. So don't underestimate it. And it doesn't break unless somebody breaks it or puts a hole here if the person wants to mistreat you by giving you a child without your consent. And that's where we tell you to observe that teeth before the action. I hope up to there I'm clear. Or am I too fast? Okay. So that you wash your hands. Wipe with the serviette or hand towel. Place it in the appropriate place. There is Depo-Provera, that is the injectable. This one, it consists of progestin only, and it is injected in the muscles, the gluteal muscles, and it stays in the body. It works for 3 months. After 3 months, you get another dose. While using injectables, some people get their monthly periods, others get spotting, which is normal, others don't get any bleeding at all. That too is also normal. So don't go back to the hospital complaining about 1, 2, 3. The only problem that can make you go to the hospital is maybe when you bleed so much, you're getting anemic, dizziness, and bleeding so much is changing pads more than 4 times a day. But not just blood, the normal blood we get during our menstrual cycle, but the blood that soaks your pad and even maybe stains your clothing or bedding at night. For that one, you can go to any health facility for advice. You can be given medicine to regulate it for some time, but in case it doesn't stop for over 6 to 1 year, we can decide or tell you about many more methods that may suit you. Yeah, that is Depo-Provera we are talking about. To take you back, a little bit back on the implant part. After you inserted the Jadel or implant or the NXT, there is also this card. There is a card. You can call it like an ID card. This one is a proof that you were inserted this method. Now this one is for Jadel. The date is indicated there, and the month, and the year, and the date of removal, that is after 5 years, whether it was inserted on the right or left arm, upper arm. And some details here that we record even in our books. So when you're given this, make sure you don't misplace it, or in case it gets misplaced, it's always advisable to come also with another book so that we indicate on the book and also on the card. Remember, when using when providing all these services, a health provider uses all the aseptic techniques to ensure that no infection or cross-infection is transmitted through giving family planning services. So don't fear. We usually use gloves, sterile gloves, to protect our clients. So I would advise those watching me, visit any health facility around you or near you, whether dispensary, health center, sub-county hospital, county hospitals, and even referral hospitals. All those services are offered there. Don't fear. Dispensaries, as I told you, it's free. Some health centers, it charges maybe something minimal. A method cannot go beyond 1,000 in a government hospital, depending on the one you choose. Last but not least, remember, everything has its failure rates. Even Panadols. Somebody can take two tablets of Panadol, and still pain doesn't go. Somebody may take one tablet, that is 500 milligrams, and the person gets healed. So while using this method, everything has a failure rate. When using combined oral contraceptives and progestin only, they have 7% failure rate. That means out of 100, 7 can get pregnant. Yeah? I know now I've shocked some of you, but that is the reality. When using implants, the same. Everything has its own. When using female condom, failure rate 21%. Male condom, 13%. Yeah, IUCD, 0.8%. That has the most minimum failure rate. Depo-Provera, 4%. Yeah. So make sure when you go to the health facility, don't be in a hurry. Request the health provider to explain to you all the available methods, how they work. Then you'll be given time to decide and adapt to the one that pleases you. But in case you have some contraindications or illnesses that may affect the effectiveness of some drugs, some contraceptives, you will be advised accordingly. Thank you so much for taking your time. See you then. Okay, bye.